Good day, future RMDs. Welcome to our discussion about fecal analysis. Our learning outcomes are as follows. Describe the normal composition, formation of feces, identify the different fecal constituents, including protozoans and helminthic parasites, and interpret the microscopic results of a fecal analysis. Start with, let us define what is a stool or what is a feces. When we said aphasis, that is a waste product that contains bacteria, cellulose, and other undigested foodstuff. Okay. Uh, Feces also contains gastrointestinal secretions, bile pigment, which is will be discussed in further thoroughly later. Why the color of the stool is brown. No? Cells from intestinal walls, okay, electrolytes, and water. Okay, one of the most important thing that you have to remember is that feces also contains water. That's why if there are cases that an individual is experiencing the what you call this diarrhea, who he or she also experience dehydration. It is because our stool contains also a water. Now, a normal individual like you or like us with a normal metabolic activity can excrete a stool roughly around 100 to 200 grams of stool per day. Okay? An individual and normal no who can excrete no every day ay kaya nyo mag-excrete ng up to 200 grams of stool per day. Meaning to say, anything that is excess no or higher than 200 grams per day is what we call the diarrhea. Alright. Human feces contains 75% of water, okay, 75% of water, and 25% of solid. This is what I am telling. Okay? This is what I am telling a while ago that an individual with diarrhea, okay, an individual with diarrhea, a severe diarrhea, can also develop okay, dehydration. It is due to that our stool is 75% water. So if you have stool excretion greater than 200 grams, therefore, no, ganun kadami ang water na nawawala sa katawan ng tao. Now, if you still remember, we have the Bristol stool of chart or Bristol stool chart. And what is the purpose of this one? The purpose of this one is to describe, I want you to take note that the purpose of the Bristol stool chart is to prescribe the consistency or the appearance, no? More on appearance, the appearance of the stool. And we said that a normal stool is a type for in classification, okay, wherein it is a sausage-like, snake-like, smooth, and soft. Okay, wherein when you release this emotion, no, ang sarap siya pakiramdam. Somehow, we can also consider type 3 as a normal stool. However, it has a crux or surface. The indication of this one is lack of water and fiber. Okay? So type 1 is a separate hard lumps like nuts, hard to pass. Ito po yung parang almonds, no? Butil-butil, parang tain ng kambing. Okay? Sausage shape but lumpy is type 2. Type 5 is soft loops with clear cut edges, easy to pass. No, ito yung mga malalambot. Okay? Type 6 is fluffy pieces with rugged edges or mushy, medyo sabog, okay? And type 7 is watery, no solid particles, entirely liquid. Usually, yung type 6 at type 7, ito yung nakikita sa mga diarrhea, most especially doon sa may mga watery diarrhea, that will be type 7. Alright, so for the macroscopic stool characteristics, now brown is the normal color. The reason why the color of the stool is brown is because of the pigment urobilinogen. What is this urobilinogen? This is from the synthesis of our bilirubin. No? This is from the synthesis of the bilirubin, okay, that converts to become a stercobilinogen. Later, I'm going to show to you the synthesis of the bilirubin so that you will understand bakit naging color brown. No? Bakit naging color brown ang color ng stool? Because of the stercobilinogen. Okay? A black stool can be a pathologic or it can be a non-pathologic. First things first is, it is a non-pathologic. Let's say, for example, so you eat dark chocolate or you eat dinuguan, you eat pusit, that can contribute kung bakit black colored ang stool. However, on the other side of it, on the pathological side of it, bakit naman nagiging black ang color ng stool? It is because of the upper gastrointestinal bleeding. Bakit nagiging black kung may bleeding? Kung may pagdudugo, bakit black? It's because age red cells na yan. Mga matandang red cells na yan, kaya naging darker ang color. Okay? It can be also due to iron therapy or charcoal or bismuths. Red can also be non-pathologic or pathologic. Kapag non-pathologic yung beets, food coloring, and bismuths, diba yung mga bismuths nito? Bismuths can be your antacids. Okay? Like black colored stool, a red colored stool can also be considered as pathological, and that is due to lower bleeding. Okay, a pale yellow, white, or gray stool can be due to bile duct obstruction, no, and then barium sulfate, and also an antacid. Green because of biliverdin or antibiotics, and green vegetables. Blue because of Prussian blue or grape soda, no, that Prussian blue din sa mga additive. Violet or purple colored stool is because of porphyria. Bulky or fruity stool, that is an indication of bile duct obstruction, pancreatic disorder, and steatorrhea. When we said steatorrhea, increased amount of fats excreted in the stool. And later, we're going to discuss that. Butterlight, cystic fibrosis. Ano naman yung problema dito? This is a sweat disorder. Okay? Mucus, blood streak, colitis, dysentery, malignancy, and constipation. So bakit po yung constipation nagkakaroon din ng blood streak? Kapag po nagkakaroon ng sugat, no? Dahil sa constipated at matigas yung stool, nagkakaroon ng splashes in the anal area. Now, like what I've said, I'm going to show to you and I'm going to discuss the metabolism of bilirubin. Okay? Bilirubin comes from the RBC extraction, no? The formation of heme, okay? And then heme to bilirubin. And as we all know, bilirubin is being transported by our albumin. This is a protein, right? And this protein transports our bilirubin, no, along with calcium ions, magnesium ions, okay, drugs, okay, transport ni albumin. Now, the transportation of bilirubin through the aid of albumin, no, will now be undergoing what we call unconjugation. Okay, and this unconjugation, it will take place in our liver. This is what we call the pre-hepatic stage. Okay, this is what we call the pre-hepatic stage. Now, again, the conjugation of our unconjugated bilirubin, also known as your B1, also known as your indirect bilirubin, will take place in the liver through the enzyme UDPGT. Okay? This UDPGT will conjugate our bilirubin, forming our unconjugated bilirubin. Now, in the absence of UDPGT, there is what we call deficiency of unconjugated bilirubin and an increase in conjugated bilirubin. Increase in conjugated bilirubin is seen in conditions such as hemolysis. Okay? Is seen in conditions such as hemolysis. Okay? Now, again, if there is a deficiency in the UDPGT, an enzyme that converts or that conjugates our unconjugated bilirubin to conjugated one, which is your direct bilirubin, which is your P2. Ibig sabihin, there will be a deficiency of this one. And there is a increase in unconjugated bilirubin because of the deficiency of this one. Next, this unconjugated bilirubin, no, will be converted, will pass through our intestinal walls. Okay, so that this will be converted by bacteria to what we call urobilinogen. And this urobilinogen that is converted by the bacteria, and this bacteria is the normal flora, no? The normal flora in our intestine that will convert our conjugated bilirubin to urobilinogen, then it will be excreted into the stool. That's why the stool becomes brownish in color. On the other side on that, on the other side on that of that, our unconjugated bilirubin, no, our unconjugated bilirubin might go back to liver, no, go back to liver for what we call reabsorption, okay, and then part of it, no, part of it will be entering the circulation. I repeat, the urobilinogen that is converted by the bacteria in the intestinal wall may enter once again into our hepatic circulation. Okay? May enter again into what we call hepatic circulation. And take note, 20% of the urobilinogen absorbed and recirculated to the liver and excreted in the stool. Or part of the urobilinogen will come to what we call, or will go to what we call systemic circulation. Okay? And then a small portion of that urobilinogen will enter into the circulation that will be excreted via urine. And that is what we call urocole. To make it simple, no, meron pa tayong tinatawag na post-hepatic cycle. Again, the bile, no, in the intestine will be converted into what we call urobilinogen. Again, will be converted into urobilinogen by our normal flora. This urobilinogen in the intestine will undergo what we call oxidation to form your stercobilinogen, okay? And the pigmentation stercobilin is the reason why the stool, as this is the major reason why the color of stool becomes brown. Now, part of the urobilinogen will be reabsorbed, no? Will be reconjugated, and it will be excreted in the urine in the form of urobilin, which has a pigment of urochrome, and that is the reason why the color of urine is slightly yellowish. That is what is happening, and that is true in what we call post-hepatic cycle of the urine. Okay? Now, another characteristic of a stool, kapag ribbon-like, there is a intestinal constriction na flatten siya. Ibig sabihin, naging constricted, no? Naging constricted ang intestine, yung stool na magpapas ay naging flatten, ay naging ribbon-like. Rice watery, cholera, no, Vibrio cholera as we all know. Pea soup, typhoid, Salmonella typhi. Scabulous, constipation, goat droplets. Okay. Now, this is what we call steatorrhea. When we said steatorrhea, there is an increased secretions of fats in the stool, greater than 6 grams per day. And best example of a condition no, na mayroong steatorrhea is yung Giardiasis. Why? Because Giardia lamblia, the causative agent of Giardiasis, is capable of what we call malabsorption. Okay? So hindi siya nakakapag-absorb ng fats, therefore the fats, it will be excreted in the stool. Okay, the screening test for steatorrhea is the examination of stool, microscopic examination of stool, and demonstration of what we call fat globules. Now, increased fat globules in the stool, okay, increased fat globules in the stool is an indication of steatorrhea. Well, definitely, the definitive test is a fat or fecal fat determination. I want to make it clear, and I want you to know that you must observe properly the presence of the fat globules. Because, remember, no, yung mga fat globules na yan, pwedeng yan yung iyong bubbles na akala mo ay yung iyong fat globules. Pwede mga bubble formation lang yan. That's why you have to make sure that the globules or the circular structure like this is fat globules. Okay, how could you differentiate fat globules from your bubbles? Yung bubbles, kapag ginalaw mo yung fine adjustment knob, magiging clear. But fat globules will appear like this, na may dumi sa loob. Again, this is just a screening test. This is not a definitive test because the definitive test is our fat or fecal fat determination. Okay, so how are we going to do the fecal fat determination? This is a qualitative test, okay, using a triglycerides or neutral fat stains because this will stain triglycerides. So how are we going to do that? We're going to prepare a stool suspension. Ibig sabihin nun, you're just going to dilute your stool into a liquid solution. It could be NSS. Plus 95% ethanol and soda. Okay? And then put in a slide and then observe for orange droplets. Orange droplets, no, is the color of the drops, is the color of the color of the droplets, the fat droplets, because of the reaction to the student stain. Now, if there are greater than or 60 drops per HPF, that is considered as steatorrhea. Again, this is just a qualitative test. Next, another test aside from neutral fat stain is the split fat stain. For fatty acids naman, emulsified stool, almost the same thing as this one, plus 36% of acetic acid and Sudan 3. Okay, again, orange fat or orange droplets is an indication of fat globules. No? Kapag greater than 100 droplets and the measurement is less than 4 micrometers, it is considered as normal. Okay, 1 to 8 slightly increase, and 6 to 75 is increase. Okay, mas maganda or mas madaling gamitin ang neutral fat stain because you don't have to measure, no, your fat globules. And dito, you have to measure pa your droplets. Dito, you have to measure pa. Here, in neutral fat stain, you just have to observe 60 droplets per HPF. Per HPF, okay? And then, if you have greater than 60 droplets for HPF. Now that is an indication of steatorrhea. Okay. Now for the quantitative test, okay, this time since this is a quantitative test, you have to use a 3-day stool. Ano po ibig sabihin ng 3-day stool? Hindi yung 3-day age stool. No. When it's a 3-day stool, you have to collect stool for 3 consecutive days. For 72 hours, all the stool that you will pass for 72 hours will be collected on a container. Okay. So the test for that is what we call the Van de Kamer titration, which is the gold standard for the fecal fat determination. Okay. So for the normal value, if the fecal fat is 1 to 6 grams per day, then it's considered as normal. Kapag greater than 6 grams fats per day, then that is your steatorrhea. As we define in, this is what we define steatorrhea, greater than 6 grams of fats per day. Okay, so for muscle fibers, okay, for muscle fibers, if we have what we call abnormal excretion of muscle fibers in the feces, that is what we call creatorrhea. Okay, now how are we going to determine if there is a increased muscle fibers in the feces? Okay, the patient should include a meat in the diet para makita natin kung talagang nakakapag-digest siya ng husay. Then we're going to emulsify the stool. That's then we're going to add 10% eosin for coloring, and then cover it with cover slip for 3 minutes, and then look for undigested fibers. If the fiber is completely digested, there is no striation. No? Kapag partially undigested, it can be the striations can be on this way or on this way. Okay. Now, if the muscle fibers is really undigested, then there is striations on both or on both directions, horizontal and vertical striations. Okay. Kapag partially, there can be a vertical or horizontal striations. Kapag undigested, there are vertical and your horizontal striations. If you have completely digested, then there is no striations. Take note that abnormal conditions that occurs in undigested muscle fibers is biliary obstruction and cystic fibrosis. Okay. Fecal leukocytes, as we all know, remember, if we still remember in our discussion, fecal leukocytes can be absent. Okay lang na walang fecal leukocyte sa stool ng pasyente. It's normal. However, greater than 3 neutrophils per HPF is an indication of invasive conditions. Pwede po siyang meron ng, what you call this? Infection. No? Now, how are we going to determine fecal fat? You all know that wet preparation, no? Wet preparation using your NSS, using your iodine solution or Lubbock's iodine, no? Or you can use Loeffler's methylene blue para mas maganda yung kulay. Pero routinely, no, for the wet preparation, we're just using NSS or Lubbock's iodine. Okay? So for dry preparation, for giving a dry preparation, no, you're going to prepare a stool sample, no, like what we did in parasitology. You have your stool sample, water, NSS, and then spread your stool, let it dry, and then fix it, and then stain using red stain or gum stain. Okay, and then look for the WBC. Okay. Or you can use lactoferrin latex agglutination, no? Secondary granules of neutrophils, okay, is an indication of bacterial pathogens. Now, we have what we call diarrhea without WBCs. And we have diarrhea with the presence of WBC. Now, therefore, hindi ibig sabihin na walang WBC, wala ng infection. At hindi porket ibig sabihin na mayroong WBC ay may infection agad. Remember, if the amount of WBC is not greater than 3 neutrophils per HPF, then it is considered as normal. Okay? So what are the conditions that can cause diarrhea without WBC? Toxin-producing strains of Staphylococcus aureus and Vibrio cholerae. Viruses and certain parasites can also cause diarrhea without WBC. Okay? Usually, parasitic infections will not cause leuco or the presence of leukocytes in the stool, seldom or rare. Okay, these are the common genus of bacteria that can cause diarrhea with the presence of WBC, Salmonella, Shigella, Yersinia, E. coli, and Campylobacter. Sino itong mga to? Mga Enterobacteriaceae, right? Now, we also have what we call the fecal occult blood. The fecal occult blood is used to determine the hidden RBCs. From the word itself, occult. Okay, it means hidden. Okay? And fecal occult blood is used for the screening for colorectal cancer. Okay, so we are using what we call a point of care testing using this kit. We're going to prepare the stool sample, and then you're going to put a diluent. Then if there is a bluish color like this, then that is positive for what we call occult blood. Okay, so we have here the H2O2, which is the hydrogen peroxide plus the guaiac. That's a sensitive test for our fecal occult blood. And then the reaction of hemoglobin peroxidase will oxidize our guaiac and convert hydrogen peroxide to water, forming a blue color. And that is an indication of a positive in occult blood. Now, what are the chromogens? We have the benzidine, we have the guaiacs, and orthotoluidine. Take note that there are positive or false positive and false negative conditions that can affect our occult blood. For false positive, red meat can cause false positive. That's why if a patient will occur or will be submitting stool for fecal occult blood or FOBT, this is your FOBT. Some says this is the SOBT. They're just the same. Fecal stool. Red meat must be avoided for 3 days. Melon, broccoli, cauliflower, and horseradish. Horseradish is yung labanos. Should be avoided also for 3 days because it can also cause false positive reaction. Okay. Aspirin and anti-inflammatory drugs must be avoided for 7 days, again, because it can cause a false positive. Reducing substances like ascorbic acid can cause what we call false positive reaction. Okay. We also have your APT, and when we said APT is the up-downy test, and this is used to differentiate fetal blood and maternal blood for newborn. Okay. The specimen here is the infant stool or vomitus. When we said vomitus, ito po yung suka. Okay. So we're going to emulsify stool and then centrifuge it, then add 1% sodium hydroxide to the supernatant. If the solution becomes pink, then that is positive for fetal hemoglobin. Most probably that is hemoglobin F, which is an alkaline resistant. If there is a yellow-brown colored solution, then that is a maternal blood. Hemoglobin A naman yan. Because hemoglobin A is denatured in the presence of an alkaline solution, particularly your sodium hydroxide. X-ray film is also a test for stool for the detection of trypsin enzyme, which is a proteolytic enzyme secreted by the pancreas. Okay. And this test is used for cystic fibrosis. Kapag nagkaroon ng clear formation, then that's positive for trypsin enzyme. Kapag no clearing, negative. Okay. For fecal carbohydrates, this remember guys that this is the most valuable in assessing cases of infant diarrhea. And this infant diarrhea is usually caused by intolerance to metabolize carbohydrates. And best example is your lactose intolerance. Okay. Now this is what we call diarrhea. Again, when it's a diarrhea, you have excretion of stool up to 20 or greater than 200 grams per day. Not increase in liquidity and frequency more than 3 times a day. That's considered diarrhea. Now, you might be shocked and you might be surprised that acute diarrhea can last for less than 4 weeks, almost 1 month. And a chronic diarrhea can be defined as a diarrhea that can last for more than 4 weeks. Could you imagine? No? Now, what are the major mechanisms of diarrhea? It is due to osmotic, altered, and steatorrhea. So let's define. Ano ba yung pinagkaiba ng tatlong yan? When we said secretory diarrhea, there is an increased secretion of water and electrolytes. When we said osmotic diarrhea, retention of water and electrolytes in the large intestine due to incomplete breakdown and food reabsorption. Okay? At kapag sinabi naman natin altered motility, enhanced motility, or hypermotility, yung mabilis, no, akala mo nagda-diarrhea ka na, pero altered motility lang. Yung pala, mabilis lang yung flow. Okay? And that can be hypermotility or constipation, yung mabagal naman. Now, kapag sinabi natin steatorrhea, secretory diarrhea, Kapag sinabi natin secretory diarrhea, this is due to bacterial infection, viral infection, parasitic infection, drugs, laxatives, hormonal imbalance, inflammatory bowel, or endocrine disorders. These are the reasons kung bakit nagkakamarot ka ng steatorrhea. So, ibig sabihin, most common type ng diarrhea yung nakikita sa tao is increased secretion of electrolytes and water na nagiging dahilan kung bakit nagiging dehydrated, and that is due to these conditions: parasitic, viral, drugs, laxatives. Okay? Kapag naman sinabi natin osmotic, like what I've said, no retention of water and electrolytes, maldigestion, malabsorption, disaccharide deficiency, laxatives, antacid, amoebiasis, no? And antibiotics. Okay? And when we said altered motility, irritable bowel syndrome, and then rapid gastric emptying. Okay? So that is our fecal analysis. Thank you very much and stay safe, everyone.